Hello and welcome to Talking Live. I'm Dr. Robi Ludwig right here in Star Shop Studio in Times Square. And today we are talking about how to get summer ready. We all have those body image things that we're upset about. And we have one of the top plastic surgeons in New York City here to join us to tell us what we can do quickly. And it doesn't take too much time. Dr. Elie Levine, thank you so much for being with us.
Thanks for having me.
We're thrilled to have you. And we actually knew each other, kind of. My son went to you and your wife practice together, and it's called Plastic Surgery and Dermatology of New York City, correct?
Correct.
And my son, who is 19, is kind of critical about doctors. I don't know if it's because his father's a psychiatrist and I'm a therapist, but he almost doesn't like anyone. I don't know why. And we went to your practice and it was like the angels were singing. He loved a dermatologist who worked at your practice. And I don't know, this dermatologist cured him and he was very happy. So yeah, exactly. We are going to have a link to Dr. Elie Levine's practice so you can find out about all the different specialties that he and his wife have. And you were telling me that because you work with your wife who's a dermatologist, you really think about surgery in a different kind of way.
Yes, there's definitely a synergy between us.
Yeah.
And there's a lot that I've taken away from working with her and seeing the dermatology perspective on things and vice versa. And a lot of issues often will need both treatments, but sometimes people will come to me thinking that they need something really invasive and procedural, and sometimes it's little things that they really need, and the other way around as well. And so we're able to gear the right treatment for people.
I think that's great. And what I just think our audience should know is that you guys both went to Yale Medical School, which is so impressive, very impressive. But I think it's great that you think out of the box as a surgeon because of what your wife does and collaborating together. Now, we were talking about the different things that people can choose to do that's pretty easy, that doesn't take a lot of recovery time, and you can get a lot of bang for your buck. So you kind of took us through 5 different trends that people can come to you for. The first one is filler. And I think everybody knows about filler. It's one of my favorite things on the planet. Actually, a plastic surgeon is my favorite kind of doctor because you walk in, it's like you want to be there. You feel good after you leave. There's like no downside. Okay, so tell us what filler can do and where it can be used right now.
So there are really 2 uses for fillers. One use is that in general, volume speaks to youthfulness.
Yeah.
And so as we age, we generally may gain volume where we don't, but we also lose volume, especially in our face.
Right.
And so volumizing in those areas, basically from the top of the head down, generally works beautifully. So it can be something subtle like in the temple area. It can be filling in lower eyelids, it can be volumizing the cheeks, the nasolabial folds, even doing a liquid rhinoplasty for patients, and then the marionette area. And then there's also the issue of things that may not necessarily relate to age-related changes, but more kind of genetic things. So some people are born with puffy eyes, and so there are ways to use filler to camouflage that. People may not like the bump on their nose, and so using it to camouflage that. Volumizing lips. All these areas are areas that really can be both subtle and dramatic at the same time.
And really, there have been new trends in plastic surgery where people are looking more natural. Wouldn't you say? How do you think aesthetics has changed when it comes to your profession and what people want and what you can offer people now?
Well, we kind of joke about these terms: bigger is better and more is better, and the reality is it's more a matter of using things in subtle ways to create dramatic results. And sometimes it's the benefits of different types of fillers in different parts of the face, and that there's so many more tools that we have now than even 5 or 10 years ago.
Yeah.
And so using the right amounts in the right areas give dramatic results, but in a much more natural way.
So you were saying that dark circles under the eyes can also be addressed. Is that a filler issue?
So darkness under the eyes,
and I'm asking for personal reasons, I admit
it. Can be a combination of things. So sometimes there actually is pigment in that area, and that's often difficult to address. But there's also a combination of puffiness or even just shadowing in general in that area. And adding volume into that area definitely helps dramatically. Sometimes it's a combination of that in conjunction with using laser resurfacing. And sometimes it's even very, very small amounts of Botox that can help. And so depending on what the issue is, all these areas are really great at addressing subtle issues relating to the lower eyelid and can create really great natural looking results.
And again, one of the reasons why we're mentioning this is because there's very little recovery time, right? So someone can come in during a lunch appointment and say, I want Botox, and walk out and go to work.
Go back to work and no one knows anything.
Yeah. So the recovery time for fillers is basically what?
Really no time at all.
Really
either.
No time at all.
Yeah.
Yeah.
I mean, all of these things can be done in the middle of the day and go back to work. There's no reason to take time off of work for any of these things. And they're surprisingly pretty comfortable.
Yeah.
Really not uncomfortable procedures.
Yeah, I've never had difficulty with any of them. So that's the upside. Okay. Mirror dry. Now, this is something I only recently heard about because my daughter brought it to my attention. And this is, some people feel uncomfortable with sweaty armpits, right? So we have a picture with, somebody who obviously is sweating. And I guess if you're going to professional meetings, or if you're on TV or being photographed like I have been at times, and there's that big wet spot, it's not the greatest look. So what is mirror dry and how long has it been around?
So mirror dry has been around for a while, but the approach to it has changed. So initially the approach was treating it for people that sweat excessively.
Yeah.
And there's no question it's really helped those patients out a lot. But the reality is on a hot day, if it's a man in a suit or a woman in a silk blouse, everyone sweats.
Okay.
And even if you're using the best antiperspirants, even medical grade antiperspirants, sweating becomes an issue. And it really can create a lot of issues related to confidence.
Yeah.
And so with a one-time treatment that takes under an hour, it essentially eliminates both the sweating, the staining, as well as the odor. And it's really using a mirror drive technology, which is basically using a heat-generated device to eliminate the sweating in that area. And it's really quite remarkable what it can do. There's a little bit of soreness for a few days, but no one needs to take time off of work, and there's no downtime from it.
So how much does something like this cost?
So something like that costs around $2,000 in the price range. But the alternative for it is historically the gold standard has always been Botox treatments, which also works wonderfully. The problem is that it lasts closer to somewhere between 6 and 8 months.
Yeah.
And the cost point is less, but not considerably less. So even if you've treated even twice with Botox, you've probably paid more than you would have paid using this device.
And so is mirror dry, is that permanent?
Correct.
It's permanent.
Correct.
And there's no side effect or danger to not being able to sweat?
You're just, no, not at all.
Okay.
Yeah.
Okay.
And it's not like you have increased sweating elsewhere in your body or any kind of other problems that understandably would be concerning and would dissuade people from doing this.
Now, I know Botox was used for sweaty hands for certain people. Would mirror dry be used for that as well?
So unfortunately, there's temporary numbness in the area.
Okay.
Having temporary numbness there, not a big deal. But in the hands or the feet, unfortunately, we're not there. And there's no question they're working on trying to tweak it and create that. And if and when that comes about, it will be a game changer for people, but we're not there yet.
Here's my fantasy, and I was talking about this maybe a little bit with you, but that it's unfair that fat goes to the wrong parts of the body once you reach a certain age, and that I don't like that at all. And I'm talking to different people. I would love to create this because I'd be a billionaire if I could create it. The fat redistribution pill. So it doesn't go to your stomach. It just naturally flows to your face.
Right.
Is that a possibility, or am I talking something like time travel, which is not likely?
You never know.
That's like, don't hold your breath. See me about fillers instead. Okay. Liposculpting. Now, this is something we did together, and I did not want to share some of the photos here for our show of me, but if you go to my Facebook page on Talking Live and Like It, you can actually see there's a machine at your office that takes a 3-dimensional picture, and then you, in a very honest way, will show what someone can expect to see after they have the procedure.
Correct. It's really quite remarkable.
It's really cool too. I loved it.
And when someone comes in to discuss an area that concerns them, it's very easy to say, okay, I've taken a look at you, you're going to look better.
Yeah.
But my definition better may be different than yours. And so
Right.
as a patient, to be able to visualize it is very
Yeah.
empowering.
Right.
To figure out, to say, yes, this is something I want to proceed with. And it really, really is quite accurate.
Yeah. I mean, I thought that was really great. And also, people have more realistic expectations.
Correct.
You know, so you're going to walk in, but you're still going to be yourself, just hopefully a new and improved version of yourself. And I just have to say, maybe I was not typical, but okay, so I was awake during the liposculpting. And I have to say, this is why I'm a therapist. I was like, wow, your job is hard. I was like, your job is really hard. And I just couldn't do it. I was really glad I was on the side of the table that I was. And one of my friends was saying, yeah, but Dr. Levine is probably happy he's not a shrink. You know, he doesn't have to listen to people. So anyway, but I thought it took like a lot of arm strength, a lot of physical strength.
It does. You really, to be a good surgeon, you need to be in decent shape.
Yeah. I mean, I don't know if you would realize that unless you were awake, experiencing this kind of procedure, which I loved. I mean, that was part of the fun for me.
Well, you're a good sport.
I mean, I just enjoyed it. But anyway, so here we have before and after. How much does something like this cost, and how long does it take to get from the before to the after?
So somewhere in the neighborhood of $4,000 to $5,000.
Okay.
How long? It's less than 2 hours. And you're sore.
The procedure is less.
Procedure is less than 2 hours. You are sore for about a week or so, as if you had done really some tough workouts.
Right.
But working a normal job is completely fine. You're showering right away. You're out of the gym for about a week or so.
Yeah.
But that's really the biggest restriction with it.
I love that as an excuse for me. But I have to say, I went out that night. And remember, I don't know if you remember, but I asked you, because I had a birthday party that night. And I said, can I go out? And you said, sure. You know, and I went out. And I had a grand time.
I'm not surprised.
I, really had no problems at all. I love not being able to work out for a week. So that worked for me. And so, but to get to that after point, isn't there swelling? So it takes a little while?
Yes. So you'll see a lot of the results even somewhere between 2 and 4 weeks as the swelling resolves and you see the volume reduction there.
Yeah.
But there's a second component to it, and that's the skin tightening.
Yeah.
And that actually, I view that almost as a bonus, is because you look at yourself after a month and already you see dramatic results.
Yeah.
But the skin tightening continues for up to 2 years.
I'm just so excited.
The results get better and better. And the nice part, besides the fact that they get better and better, is that the transformation is slow and subtle.
Yeah.
And so people are able to pick up on the fact that you look better.
Right.
They're not necessarily able to pick up on why you look better.
Right.
They just know you just look better.
Yeah. And this is also a new technology that did not exist 4 years ago.
Correct. And so there's always an evolution, and this is the exciting part of the science and how it meets into the medical end of things. And it's really about trying to come up with the best devices to tighten skin down. So the device that I was using 7, 8 years ago has been replaced by something that I replaced it with 3 or 4 years ago. And then somewhere around 2 to 3 years ago, I transitioned over to a radio frequency based device that is just spectacular in terms of skin tightening.
Yeah. And what I love is that this is really, cutting edge. And you said something also that was really interesting, that the earlier you start, and I don't know what you define as earlier, kind of the better you are able to maintain your youthful look. Did I get that correctly?
Yes.
Okay.
And so I'm not looking at a young person doing a lot of work, but the reality is that if someone is debating to do a procedure, doing it on the slightly younger side has benefits, because you're going to tighten down more, and you're going to get more longevity from the procedure, and it's going to be a more dramatic result. And so starting early, even with subtle small things, really is helpful for people.
So is that across the board for all of the procedures that we mentioned?
I think for most things. I think the problem that people run into where they push the limits of what's going to look natural is where they push off things as long as they can, and then they try to do a lot. And it's so much better if you do little things along the way, even things that require no downtime at all. And that way people don't really see you changing at all.
Yeah.
And that way when you reach older ages, you look younger, but also look quite natural.
Somebody told me the other day last week that I was looking younger. And I said, I know great plastic surgeons in my neighborhood up the block. And then I share websites. So anyway, which is a true story. Okay, so on to Now, I'm going to have you say the name because I know I'm going to just mess this up. The injection treatments for spider veins, which can be a real source of contention.
Yes.
And really not be the best look. We have this right up here.
Yes.
All right, sclerotherapy.
Yes. So the superficial veins that, men get it, but it's far more common in women. And
of course,
childbirth makes it worse. Genetics play a role in it. And injecting them and eliminating them instantaneously is really quite spectacular.
And that's permanent?
Yes.
Is it painful?
No.
Okay.
No, you don't need to use anything in terms of numbing or anything. It really is quite spectacular and quite comfortable.
Now, I think everything we've mentioned so far doesn't require anesthesia. Correct? So everything is you're awake for it, you're in, you're out, and the recovery time is very fast. Now, how much does this kind of therapy cost?
I think it's somewhere between $500 and $1,000 a treatment. It really is not a lot.
Now, is that for just one area?
So it's generally done by the time period, and you can really do a large area in a short amount of time because you're really using the tiniest little needle and injecting. Okay. And you're really, when you see a larger area, you're not injecting the entire area. You're really just finding those 2 or 3 little spots that are really the starting point, initiation for these veins, and injecting those, and the whole thing disappears.
Now, what does it do medically? Does it reduce the size? Is that what happens?
So it completely eliminates those little superficial veins. And those aren't veins that we need functionally. They're really a result of valves that aren't really functioning properly. Okay. And so you're eliminating veins that we really don't need in those areas.
Oh, okay. Now, breast augmentation, which I think we've all heard of. And here, and it looks like there was a little liposuction done there as well.
There's a bit of a mommy makeover.
Okay, which we're going to talk about. Okay. Right? We want you back for the mommy makeover.
Sounds good.
And midlife makeover. We're going to combine that. So you'll come back and discuss that with us? Okay. All right. So what did you do here?
So this is, this patient actually had a tummy tuck in addition to a breast augmentation. And, there are 2 reasons why someone will undergo a breast augmentation generally. Generally, they're either unhappy with the size of their chest, and that's going to more typically going to be on the younger side patient, although it can be older patients as well. And then they're with having children or significant weight changes, you lose breast volume. Right. And so it's often used to recapture volume that you may have had to bring you back to the way you were before. And it can be done with tiny little incisions, either near the edge of the nipple that you won't even see. It hides really nicely that border, or underneath the breast fold. It's about a 2-hour procedure. Okay. You're sore for about a week, but the recovery is quite easy. And then there's kind of an added dynamic to it that's kind of on the newer front, and that is using fat transfer for breast augmentation. And there are really a few utilizations for it. One is as a substitute for implants for patients that want to use their own tissue in order to augment. And that I'm really just using a few needle sticks. There's really no incision at all for it.
I'm available to donate fat if anyone wants.
I wish it worked that way.
I keep trying,
And then there are also patients that may have years ago had breast augmentation. They don't really want to address that, but they've lost some volume in the upper portion of the chest. They don't need to necessarily redo the whole operation, but we take a little bit of fat from somewhere else and volumize there, and it essentially really hides that implant and creates a much more natural look to it.
It's amazing, just all of the advancements. Now, I would think you would need anesthesia for that, or no?
For this, you would.
Okay.
Yes.
Okay.
And it's really the discomfort during the procedure, but afterwards it really is quite comfortable.
Well, we have a new intern, Elie Levine. We're so excited to have her. We're going to bring her on the show. And this is the first time that she actually is contributing to Talking Live. And she did a poll for us, and she also is going to give us her thoughts from the millennial perspective. And Dr. Levine, you have 2 daughters who are in college.
Yes.
So you know this
Definitely
age group.
Relates.
Yeah, this is something you understand. Okay, Elie, tell us your thoughts about just plastic surgery in general and body image.
Well, for me, I know going into the summer, I'm mainly focused on 2 different things, and that's losing any weight that I gained over the winter and basically just looking good on the beach or in a bikini or anything that I would want to do over the summer. And being tan is also a big part of what I want for my summer body, and I know that I can speak for a lot of people my age on that also.
Yeah, so that makes sense. Is that what you hear as well from this age group?
I do, but I'm a little nervous about the tanning.
Yeah, I was wondering if that was going
I'll wait and hear what you have to
say. Yeah. So I actually conducted a poll with a lot of my school friends from Florida and from home, and a lot of people said that they were focused on mainly just their stomach looking good over the summer, because wearing a bikini, you just want to be as comfortable as possible on the beach, being happy. And that a lot more people said that they just focused on their stomach more than their legs or their breasts or anything else. So that was interesting.
Does your age group consider going to a doctor for liposuction or sculpting or any of these things? Do you hear that that's going on?
Not so much. I feel like that could be like a second option. I mean, for me, I just eat well and just try to like lose the weight on my own. And then if that didn't work, I guess someone would maybe think about plastic surgery. But I know that first people just try it or do it on their own, work for it on their own.
Yeah, that makes sense.
Yeah.
I agree. I think that people will try, it could even be 3-4 years and try to address an issue. And if they can't, and they realize they're reaching the point where no matter how much they work out or what they're eating and they're not addressing it, that's when generally I'll come into play. But right away, there's no question that being able to lose it through diet and exercise is really
and also youth, I think, can
helps
cover a lot, at least in our culture. Why don't you sit with us till the end of the show, just so people can look at your pretty face and get used to you. And we have a segment called Ask the Doctor.
Okay.
And we have visual up here of you. Ask the Doctor segment. What are your most requested procedures right now?
So it's somewhat seasonal, but there's no question that body contouring, and not necessarily in the millennial age, which is a little bit older, is a really big thing, because people are really thinking about what they're wearing on the beach or in clothing that's a little more revealing. And so it can be anything from liposculpting and subtle things. It can be breast work. It can be arms. It can be little things like addressing their knees. And so that is very big this time of year. I think also there are a lot of people that are coming back either completing school or at the end of the school year. We're talking about college age or grad students and people like that. And they're looking at things like rhinoplasties and doing a little bit of liposuction under their neck or chin. And then there's a large group of people that are coming in that have better schedules over the summer. So they're either school teachers or bus drivers at work in schools, or even people in other jobs that the workload gets a little lighter. So they're doing any number of things, from facial cosmetic work like faces and noses and eyebrows and areas like that, to body contouring as well.
Do you think our social media culture influences what people want from you?
Yes, and there's some good and some bad in that. So the bad part, of course, is people coming in looking for extreme makeovers or unreasonable things, and that's obviously a bad thing. But the good thing is that there's so many people out there in the media now that have different shapes and sizes, and everyone doesn't necessarily have to look like a supermodel. And so there are a lot of people coming in saying, I realize I don't necessarily have the best physique, but I want to look like someone like this or that. And it's very reasonable for them to seek that out. And so it allows people to be able to embrace who they are and just touch it up, as opposed to trying to do things that are dramatic and really not great for them.
From the research I've done is that a lot more patients are being proactive about what they want. And it used to be the doctor would inform them what they needed. I remember when I first went to a plastic surgeon, I was a young kid, and it was about something, taking off something on my back, and then he wanted to like redo everything, and I was like, no. But that was kind of the model then.
You're absolutely right, and it's so much healthier now, because it's very. I don't really recommend things for people. It's more typically coming in saying, what are your concerns? What can I help answer? And yes, there is some expertise I bring, and there are times where people come in and they say, I want this. I say, this isn't really great for you. These may be your options to address that. But they're coming in voicing their concern. It's empowering. It really is.
I mean, one of the things I love about your approach, aside from trusting you and your intellect, you're really honest in a very direct, kind way, but you're very honest about what can be expected, and I like that. That's comforting.
Thank you.
I think,
I think that the best way to really approach people is you try to visualize that it's a friend or a relative sitting across from you. And if it's not something that would be right for them, it wouldn't be right for you.
Yeah, that's a great approach. When does someone know that they're ready for plastic surgery?
That's a great question. Sometimes it can take years to get to that point. So there's sometimes where people come in and they know what they want. They've done their homework. They've looked online.
Mm-hmm.
They've talked to people, and they come in really confident this is right for them. And sometimes it's people coming in and talking about something, and I have a large amount of confidence at some point they'll be back. It may be 6 months later, maybe 2 years, maybe 10 years later, but they're probably going to address it at some point. And then, of course, there's some people that come and say, this is great. I gathered so much information, but I'm now happy that I'm not doing something, but at least I'm coming from it from a position of knowledge.
That's so interesting.
But I do think that it's generally going to be anywhere from 6 months to 3 to 4 years, because these are great procedures for patients, and they do great. But these are big decisions for people, big decisions in terms of their finances, and big decisions in terms of the leap of faith of doing something elective. And so sometimes it's quite quick with people, but sometimes it takes them a few years to get to the point where they're really excited about it.
Do you feel that you're seeing a wide range of people choosing plastic surgery now?
Yes. I think that it used to be viewed as one of the things that was meant to a restricted group of people. That it was meant for, we'll call it the super elite. And now there's the understanding that it really is for anyone and everyone. And so people are coming in from all walks of life, and it makes my job interesting.
Yeah, I'm sure it does. Now, this is from one of our fans who had this specific question. She said she's a really busy person. She's kind of like world renowned in her area. And she said she barely has time for a pedicure, and she wants to know how she can have time for a neck lift, and how long is the recovery process?
It's a great question. So it somewhat depends on how severe her neck laxity is. Because if it's what I'll describe as more mild to moderate, then there's a 1 hour laser procedure where I use a needle stick. I don't even make an incision, that you're awake for the whole time, that really improves the neck dramatically. And you're a little bit swollen for 3 to 5 days, so it's a long weekend, or a holiday weekend or something like that. But for someone who needs a lot of neck work, and they have a very loose neck, and some of it is age-related, but a lot of it is genetic, it's probably closer to 2 weeks. So it may be something as short as a few days, and it may be something as long as 2 weeks.
And how much does something like this cost?
So the laser procedure is in the $4,000 to $5,000 range, and a neck lift is probably about 3 times that.
Okay. Oh wow.
Yeah.
So it's pricey because I guess it's more work.
And it's at least in my hands, a good 4 to 5 hour procedure, and the recovery is quite comfortable, and there's not a lot of discomfort, but there's a lot of detail into it.
I bet there is. Okay. So do you have a favorite procedure to perform?
So one of the things that really drew me to plastic surgery was the variety of it. I really enjoy working from head to toe. If I had to pick 2 things that I really enjoy, I would say facelifts are really enjoyable. And in order to achieve a natural looking facelift, it's not the kind of fearful lifting effect. It's more a matter of repositioning things back to the way they were. I'll often integrate fat transfer into that to add added volume, which is also youthful. And then also mommy makeovers are great because my wife, we have 5 kids.
Well, first of all, I just have to say your wife is gorgeous and skinny. And where did the 5 kids? How did that happen? Anyway, kudos to her.
Having kids it beats the heck out of a woman, simply put.
I know.
And there's a lot of satisfaction women get to recapture that body they had beforehand. And so whether it's breast work or their belly or a combination of things, it's satisfying to help people out.
Now, would you include the midlife makeover for that? You see where I'm going here? All right. Allie, any other questions for Dr. Levine?
I think I'm okay.
Yeah. So it's just interesting to see the range of ages and just, everybody has body issues. And thank God that there are people like you out there who are talented and know how to do these procedures in a safe way. Because, you have to know who to look for and how to look for the right person. So we're going to have your website up so people can find you in New York City. And we are so glad that you joined us for this special Talking Live of how to get your body summer ready in a jiffy. And thank you for joining us. And thank you, Allie, for the poll that you did and joining us on Talking Live. And we'll see you next week.